The COVID pandemic was a major turning point for many things, especially the public's trust in doctors and the medical system. Someone commented on one of my videos about this pattern of distrust, and it got me reflecting back on those dark years. And I think it wasn't just about the chaos of the virus itself, it was the messaging. Because during COVID, public health messaging kept changing. First, masks didn't matter, then suddenly they were essential. First, it was 2 weeks to flatten the curve, then months dragged into years. And vaccines were promised to stop transmission with almost no risk, and then breakthrough infections and documented side effects really shook that confidence. For the public, these shifts looked like lies or cover-ups, but in reality, science was evolving in real time. We were essentially building the plane as we were flying it. And I think one of the problems was that nuance never made it into the sound bites, and instead of explaining uncertainty, public health leaders often dealt absolutes. And when those absolutes changed, people felt betrayed. That's how distrust spreads, and once trust cracks, it's nearly impossible to glue it back together. And here's the irony. Over the last few decades, medicine has moved to being more collaborative, where doctors lay out the risks and the benefits, and patients share in the decision. But during COVID, public health took a paternalistic turn where it became our way or the highway, even when the evidence was still evolving. And the harm of lockdowns, social stunting for kids, isolation and depression, small businesses collapsing, these trade-offs should have been openly discussed and weighed against ICUs filling and vulnerable people dying, but instead both sides villainized each other as being reckless or authoritarian. And here's where I think that it got really messy. That distrust didn't stay in healthcare, it spilled into culture, where people started virtue signaling, dividing into silos, and turning masks and vaccines into symbols of identity. And before long, COVID wasn't just about health, it was about politics. So I think if we want to rebuild trust, we need transparency. Honesty about what we don't know is just as important as what we do know. Because in medicine, certainty is rare, but trust is everything.